2,660 cases of coronavirus in Victoria. That is 127 more than yesterday. The breakdown of those, and of course Brett can add to these numbers with any insights. 34 of those 127 are connected to known and contained outbreaks. 40 are the product of routine testing. 53 are under investigation by our public health team. And obviously the details around those will either be covered in the Chief Health Officer's media release and statement later today and or reports that we'll provide to you in the coming days. There are 645 active cases of coronavirus across the state. On testing, can I indicate to you that despite the inclement weather yesterday, very challenging day normally to keep testing numbers up, but we have achieved 24,528 tests. That, I think, is surely across the course of a weekend a record in terms of the amount of testing we're doing. And again, we thank each and every Victorian who has come forward to a retail site, to a GP clinic, to a drive-through site, all those who have agreed to a test when somebody has knocked on their door and offered them one. As I've said many, many times, and I'll keep saying it because it is central, that data, those test results are critically important in our collective fight against this virus. And again, I'm so proud and grateful to everybody who is doing those tests, both the people who are taking them and those who are consenting to being part of that testing process. That means in total, we have completed some 952,699 tests. That is without any doubt one of the highest rates of testing per 100,000 anywhere in the world. We have 31 Victorians in hospital and 5 of those are in intensive care. Sadly, it is my duty to inform you that a man in his 90s has passed away overnight. He was in the care of one of our hospitals. We send our condolences and our best wishes to his family and loved ones, his friends. This will be a very difficult day for them. And we send our sympathies to each and every person affected by that tragedy. Out of respect for the family, I'll provide no further details as to that person's identity or any further details about that case. If that changes over time, then of course we will, but at this stage we're not in a position to shed any further light on the circumstances of that individual. Now, I've got a couple of other things I want to take you through. Firstly, from 11:59 p.m. midnight tomorrow night, the border with New South Wales will be closed. That is the result of a phone hookup between the Prime Minister and the Premier of New South Wales and myself just an hour or so ago, where we have all of us agreed that the best thing to do is to close the border. It'll be enforced, that closure will be enforced on the New South Wales side so as not to be a drain on resources that are very much focused on fighting the virus right now across our state. And I'm very grateful to the Premier of New South Wales for her support in giving effect to that. This is one of those precautionary measures. It's one of those things that I think will help us in broader terms contain the spread of the virus. And what it means, for instance, is many staff who are currently being employed or being deployed to take temperatures, to do all sorts of coordination work, whether it be at our airports or at train stations, for instance, will no longer have to do that work and can potentially be redeployed into other, arguably much more important roles. I apologise for any inconvenience that will cause people who've got unavoidable travel to New South Wales. There will be a permit system and there'll be further detailed arrangements will be announced by the Premier of New South Wales a bit later on today. But there will be a facility for people who live on those border communities to be able to travel to and from for the purposes of work, purposes of the sort of essential health services that they might need. I'll give you one example. The Albury Hospital, which is actually run by us, is of course on the other side of the border. There are some services that can be accessed in Wodonga. There are others that can only be accessed in Albury. There'll be specific arrangements put in place to make sure that people can get, in that example, the health care that they need. I'll leave it to Premier Berejiklian to make further announcements, I think, in the next couple of hours about some of the details of how that arrangement will be rolled out. but that is the product of a joint decision and an agreement between the Prime Minister, myself and the Premier of New South Wales, one that I think is the smart call, the right call at this time, given the very significant challenges we face in containing this virus.